All right, I think we'll get ourselves started here because the first bit of this is just an intro anyway. Wanted to say hello to everyone as you're kind of coming in the room, joining our webinar today. Thanks so much for making time in your schedule to join us and welcome you to our session. My name is Simone Lilly. For anyone who doesn't know me, I am the Manager of Community Investment here with End Homelessness St. John's, and I will be facilitating this session today. The two presenters today, our two main presenters, are my colleagues, Doug Parsons, who's our Executive Director, as well as Jennifer Tipple, who's the Director of Strategy. I do want to start today by just respectfully acknowledging that the island of Newfoundland is where we are located and joining you today and presenting from today. And just acknowledging with respect that Newfoundland is the ancestral unceded homelands of the Mi'kmaq and the Beothuk. And certainly today we know that these lands are home to a diverse population of Indigenous as well as other peoples. And I'd also like to acknowledge with respect the diverse histories and cultures of the Mi'kmaq, Innu, Inuit, and Southern Inuit of our province. Just a bit on our agenda today, you see it in front of you. It's pretty straightforward. We're going to start with our Executive Director, Doug Parsons. We'll give a bit of a welcome in terms of End Homelessness St. John's, just a bit of an overview, as well as an overview of our COVID-19 response to date. Then we'll move directly into our request for proposals that I imagine most of you have seen. Jennifer is going to give an overview of the purpose, as well as the framework, the evaluation criteria that will be used, and importantly, how to apply. At the end, there will be a Q&A session that will have a significant amount of time to answer any questions that you might have. Before we get started, I do want to go through a little bit of housekeeping. If you haven't noticed yet, we are all muted. Well, not our presenters, but you all are muted. But that doesn't mean you can't communicate with us. You can certainly use the chat function to say hello or make some comments. But if you do have a question, we ask you to use the Q&A feature for questions. That's how it'll trigger us to answer them at the Q&A session. And if we don't get to them all today, we will be answering them on our RFP website, and the link is there. And I'll also note that this webinar is being recorded. So I'm going to pass things over to Doug Parsons.
Great, thanks, Simone. Welcome, everybody. It's great to be hosting this webinar on the RFP. It's come together through a lot of hard work with the End Homelessness St. John's team. So just wanted to say thanks to them, all the hard work with the Community Advisory Board and the End Homelessness St. John's Board of Directors. So a lot of work going into this to make sure that we have plans in place for when we receive, if and when we receive incremental funding through Reaching Home, starting in April of this year. Just a bit of background for End Homelessness St. John's. So we serve as the community entity for the federal government under Reaching Home. And, as we've transitioned out of the city of St. John's and into our own nonprofit over the last 2 years, we've really stuck to our vision that we work every day towards a vision in which every resident in St. John's has a place to call home. And the work that we're doing as a team and as a community with all of our stakeholders is to have St. John's become the next community in Canada to end homelessness. And it's only going to happen as a result of all of us working together. So we're excited to be here and putting out an RFP that will allow something like that to happen. Our mission within End Homelessness St. John's is to prevent and end homelessness in our community. So we work collaboratively with our community partners, our public system partners, and we support the coordination and lead that coordination and integration of the system-wide planning to ensure that we can reach our goal of becoming the next community to end homelessness. And a lot of that work is done through federally mandated requirements like coordinated access and implementation of a coordinated access system or an information management system through HIFAS 4, but also through key investments and making sure that we're honing in our investments and our strategies to support those who are most in need of resources and services at the local level. So we've had a bit of a COVID response to date. It started as a COVID response at the beginning of April of 2020 when the federal government announced additional investments that were sustained through Reaching Home. So that allowed us to make, really strategic investments into the community to really target, community specific needs. And I'll get into that in a second, but, we're really fortunate that our federal government stepped up in that time of need and has sustained that investment over time. And we're continuing to expect that, even though we're moving from a COVID pandemic stage to what's now the endemic stage, as our public health officials here in Newfoundland and Labrador have suggested. So as we see needs and our informative needs to our community partners, we try to respond using those federal funds in a way that's going to have the most impact. So that's why we're here today again, is to figure out how do we use our funds in the most efficient and responsive way. So a lot of our focus to date over the last 2 years pretty much now has been on a few key priority areas that the Community Advisory Board has identified. Namely, the COVID isolation designated site where folks who were in shelter and needed to isolate could go. We did that in partnership with our harm reduction nurses and team with Eastern Health. Along the way, investing in supports, emergency supports through food security and Food First NL specifically, and emergency services through 211. And to date, we've had two different rounds of RFPs that have gone out to support housing services. So that first RFP that we did in November, in the fall of 2020, we had about $400,000 committed into 10 applicants. In the second round, that was held in the winter of 2021, especially as we were receiving confirmation of additional funds into the next fiscal year. We matched with NL Housing to support close to $1 million in supports that were available for folks in the community. Now, today, we're at a point where we're expecting this additional funding to come through, and we wanted to issue a third RFP in advance of confirmation of those funds. So that way we could maintain as much continuity at the community level as possible. So right now, based on what we're projecting, it's not confirmed by any means, but projecting is we would want to put in about $1.5 million into a round of RFP positions that are targeted specifically for those experiencing chronic homelessness, with the goal of reducing that number by March 31st, 2023. So I will turn it over to Jennifer, who will describe the proposal in more detail. Thanks again.
Thank you so much, Simone, for opening up the presentation and moderating today. And thanks to Doug for that introduction. So as Doug mentioned, today we're focused on the 2022-2023 RFP, which we're estimating at about $1.5 million. And the purpose of this funding, as we said, is really to enable our community to respond to COVID-19 in an endemic format. We have received guidance from our Community Advisory Board to get back to our roots, which of course is ensuring that we have an ecosystem in place where we're able to end homelessness. And so we're looking to fund housing supports to do this via the by name list, which is the real-time list of all known people in St. John's experiencing homelessness. We're particularly putting a focus on chronic homelessness in St. John's. Currently, our by name list, about 50% of all known folks are experiencing chronic homelessness. And what we'd like to see is a goal of reaching functional zero chronic homelessness by March 31st, 2023. So that is only a short year away. By the way, folks, if you do have any questions about any of the terminology that we use throughout this presentation, I would encourage you to refer back to that RFP guide in Appendix A. All the definitions are laid out there for you. I'm also going to say, before I go any further, my team knows I get super excited about presentations and especially RFPs, probably the only person in the world. So if I am yammering on a bit too long, I give permission to rein me back in a little bit, because we do want to save time for question and answers. And just keeping an eye on the time there, and also keeping an eye on the chat and the Q&A. So, all right, our funding source. This RFP is funded 100% through Reaching Home, which is Canada's homelessness strategy. This is only made possible through our incremental funds through Reaching Home, which started off as COVID emergency funds and have now evolved into more incremental funding that is more designed to enable us to respond to homelessness in a post-COVID-19 world. And on that note, we are ensuring that we're adhering strictly to our Reaching Home mandatory community level outcomes, which are sent out for all designated communities at the Reaching Home level, that federal level. So the first one is that chronic homelessness in our community is reduced. There is across the board nationwide a focus on reducing chronic homelessness. as well as reducing homelessness overall in the community, and for specific populations which are left to the discretion of communities, with the exception of Indigenous homelessness. All communities must have a focus on reduction for Indigenous homelessness. The third one is that new inflows into homelessness are reduced. And the last one is that returns to homelessness are reduced. Now we get it. A lot of this language is a bit technical, a bit jargony. What does this mean for us here in St. John's? Well, here it is in words that everyone is able to understand. We strive to ensure that homelessness in our community, when it exists, is rare, brief, and non-reoccurring. So those three words are really important. Rare means that the number of people that are experiencing homelessness in our community is reduced. Brief means that the time that people spend experiencing homelessness, that we're able to shrink that down and get people housed super quick. Non-recurring means that hopefully once they encounter the homeless serving system, they get the supports they need and they don't need to come back through that system again for the help they need. So the timeline for our RFP, as per Reaching Home, all projects must be completed and funds spent by March 31st, 2023. So we are looking at a 1-year time parameter. Having said that, we are looking to extend this project until March 31st, 2024. We recognize that sustainability of projects hinges a lot on having that longer time parameter. So we would like to do that, just with the caveat of two things. This, of course, requires us to have confirmation of further incremental funding through Reaching Home up till the end of 2023-24. And of course, our outcomes evaluation. We need to ensure that these projects are successful. Okay, so I'm getting into the requirements here now, and I don't want to go through everything in detail. So we've actually put the page number here for the RFP guide, so you can refer back. So there's 6 requirements for the RFP, and these are reflected in our evaluation criteria as well. Number 1, active MOU is pretty simple. Number 3, integration with HIFA-4 is something that's required for all organizations through the MOU. Number 4, good standing with EHSJ is fairly simple as well. I just want to spend a little more time on number 2, which is the integration with coordinated access to homes. This is really important because this is where we see that interplay of the great work that's being done out there in the community that will be funded through this RFP, and how that actually translates into our by name list of folks experiencing homelessness, and really how we see the needle ticking down on our numbers of people experiencing homelessness in St. John's. So that's really important. I'll speak to that a bit later as well. Number 5 and number 6 are also really important. Number 5 has to do with that sustainability. One of the factors that's, a key success factor, I guess you could say, of the supports in the community is that, so when there is employee turnover or there is prolonged absence, there's a plan in place for that. Otherwise, it can really affect our outcomes and our ability to deliver on the outcomes of the project. And number 6 is ability to meet participants in the community. This one is really important because in order for us to be able to work with people and ensure they have access to housing and to maintain that housing, we've got to be able to get out there and meet them where they're at. A lot of the time this means in-home visits. A lot of the time this means meeting them at the shelter or wherever they happen to be staying. And it also means being able to transport individuals in your vehicle, being able to do home viewings of rental units, things like that. So this is really critical to the success of this project. So we've included it as a requirement in this particular RFP. Now, the framework is listed in a lot more detail on pages 6 and 7. So I'm just going to give a pretty broad overview here today. This is all informed by the by name list using real-time data as we know it right now. And like I said before, there's a focus on chronic homelessness, and we are using chronicity as a proxy for determining complexity of needs. Generally, the longer a person's been experiencing homelessness, the more complex their needs, not always, but we're using that as a proxy. And then of course, being flexible with respect to what we know about an individual, as well as a strengths-based approach. As well, both models that will be funding through this RFP must subscribe to the housing first philosophy. So that means there are no requirements for housing readiness. Everyone deserves a home, and that's the first step on this journey, is ensuring that people get access to the home, to their home first and foremost. So I did this analogy, my favorite analogy of 2022, is not in the guide itself, but I do feel like it's a helpful one for us to have in a slide in the presentation here today. It's really the supermarket analogy. You know, when you're going to the supermarket and you need 15 items or less, you know, you kind of go to the basket, you're carrying it out, you know, that express checkout line is able to see a lot more people in the run of an hour or the run of a day, because, you know, it's lower, less intensity, less complexity of your shopping list, I guess you could say. We contrast that with the housing focused case management model, which is really, you know, the person going through the supermarket checkout line with a full cart of items for, you know, a family of 5 or 6 people, that type of thing. So we just use this analogy to reflect the fact that when we're looking at investing in these supports, we really want to ensure that we're matching the needs of the folks that we're serving on the by name list, that we're able to meet them in terms of that complexity, which of course is higher for the housing focused case management model and lower for the rapid rehousing model. So consequently, that means that in the housing focused case management model, we're looking at typically a smaller caseload size and a longer length of stay, so that we're able to address you know, that complexity of needs, which typically is a matter of getting someone housed, ensuring that there's access to that housing stability, and also, you know, continuing to maintain that housing stability for some length of time. So we're looking to fund up to 12 of those positions in the housing focused case management model. And we would contrast with the rapid rehousing model, which of course is that shopping basket, a lower, less intensive complexity of needs. The caseload size could be larger, say 15 or more. The length of stay correspondingly is shorter, 12 months or less. And based on the needs that we see reflected on the by name list, we're looking to fund up to 6 of those positions, in part because we recognize that there's a lot more turnover with those, and those positions would be able to serve a greater number of people over time. So if we put that together, you know, using our $1.5 million that we've estimated for this RFP, this is what we'd be looking at. You can see the greater proportion of housing focused case management positions, and then also that corresponds in the number of caseload spots. Okay, moving right along here. So choosing your approach, and we've just provided some guidance to potential applicants for this. This is listed on page 4 of the guide. So just some guidance there with respect to how many positions you're applying for. Just some quick notes on that. Proponents are welcome to apply for one or both models, and one position or more than one position. So it can really be that, you know, whatever you feel that your agency is able to serve, and particularly based on the population that your agency serves. So we certainly encourage you to refer to Appendix B, which has some data on what we currently see in our by name list, accurate as of this month. So organizational capacity, in-kind resources and partnerships will all be reviewed as part of the evaluation criteria. That's pretty standard. I do want to address specifically staff funded through the 2021-2022 RFP, because I think this will be a question that folks will definitely have. So we want to ensure that any position that we fund through this 2022-23 RFP meet the revised approach of this RFP specifically, whether they're using existing or new staff. But we realize that we've had a lot of success with our 2021-2022 RFP positions, and wherever possible, we would like to ensure that continuity and sustainability of both staffing positions and of clients served through those. So yes, we would make every effort to ensure that the previous funded staff would continue into this, but again, really make sure that those positions are meeting the revised approach of this RFP. Okay, so what to expect from us? You know, we're asking a lot from agencies in this RFP, and we want you to know that we have high expectations for ourselves at Homelessness St. John's as well. We're here to support the community in a number of ways. So on this slide is a list of overall community supports that we'll provide. Those include coordinated access to homes. We're mandated by Reaching Home to run a coordinated access process, and this is what ours is called, Coordinated Access to Homes, CAH. And what that means is a set of standardized protocols and an updated by name list that allows us to make decisions that are based on real-time information in the community. This is overseen by the Coordinated Access to Homes Working Group, which reports through to our Community Advisory Board. So we have full transparency and governance with respect to how this process is run. And we also seek input from the community on a quarterly basis through our community planning sessions. We also, everything that we do through Coordinated Access to Homes is measured through our participant outcomes. for both, like I said earlier in the presentation, focus on ending chronic homelessness and as well ending non-chronic other forms of homelessness as well. Everything that we do needs to be reflected through coordinated access to homes in that by name list. So every single person that's served, their housing outcomes need to be reflected in that list so that we actually have, you know, that real-time snapshot at any given point in time of our progress towards ending homelessness in St. John's. And when HIFAS-4 is implemented across the community, it will also be reflected there. We will be providing a dashboard to the community. And this is a visual depiction of our progress as a community towards ensuring, like I said earlier, that homelessness in our community is rare, brief, and non-recurring. So stay tuned for that. HIFAS-4, as I mentioned, implementation is currently taking place as well. And Homelessness St. John's also has a suite of our own housing support resources that we run in conjunction with the resources that are available in community. Those include our Home Connect program, which enables participants to access the rental housing market, the private rental market, as well as our supported referrals program, which is kind of a quick resource, financial resources for folks looking to access or maintain housing. And we also provide support with respect to community navigation, landlord engagement, and other forms of support. So those are overall. Our next slide is specific supports for these funded positions, and these are a bit new to us. We're looking at a proponent onboarding process that would complement the service agreement that would be signed by all proponents, as well as that MOU. So really what that's looking like is just providing a bit more support to proponents in terms of review of the caseload model, what reporting looks like this time around, all that kind of stuff. This year, we will also be ramping up our efforts with respect to training, education, and professional development. These we've run in the past. They are all free of charge. They're available to all our community partners. And stay tuned for those because the trainings that we'll be offering in the next year are all currently under review by that Coordinated Access to Homes working group. We're also looking to provide case management leadership support, and this is particularly for the housing-focused case management model. We're looking at providing greater support with respect to coordinating staff positions across agencies to really set those positions up for success when it comes to working with folks with greater complexity of needs. So stay tuned for more information on that. That's kind of in the works right now. And finally, we're looking at a transition plan for how do we get from the 2021-22 RFP into the 2022-23 RFP to ensure that there is minimal disruption in supports for both clients as well as the staff members. So yeah, we will be supporting successful proponents with that as well. Okay, accountability and reporting. This is outlined on page 10. It will look a little bit different from last year. The financial reporting will be the same. That's mandated through Reaching Home as well. Financial reporting on a quarterly basis. The activities report will be in narrative form only. Prior to this, we used to have agencies report on their outcomes. Guess what? I think this is great news. We no longer need to do that on a quarterly basis, you know, sitting down and, okay, going back in time, all right, who do we serve this quarter? This is all going to be done on a real-time weekly basis through coordinated access to homes through basically two mechanisms. Number one is submitting those CAH intake forms, which is the way that we use to capture information on the demographics of the folks that we serve, as well as current housing scenarios and information about folks' their barriers to housing, their strengths in terms of housing, et cetera. The other thing that we require agencies to work with us on is submitting weekly caseload updates. So this would be that updates in terms of who's all on your caseload right now, what are the changes in housing status. Ideally, this is where we would like to see people being housed, and we would report that on the by name list so that we have that real-time snapshot, or at least weekly snapshot of folks in our community that have been matched to homelessness, matched to housing, and you know who we still need to be working with on an ongoing basis. In addition to that, we'll be looking at model fidelity. So that's the model with respect to, you know, what the caseload composition size, like the stay looks like, but also with respect to housing first to ensure that all of our partner agencies are operating from that housing first philosophy. Okay, I think I'm doing pretty good on time here. I haven't seen any canes come across the screen yet, so that's a really good sign. Project costs are outlined on page 11. So where we're looking at two different models here, the costs are slightly different. For the housing focused case management model, we would be looking at a per position salary base of $65,000 annually, plus up to 20% MERCs. So this is, sorry, that's the mandatory employment related costs. I can't believe I remembered that. So that would be a total of $78,000 per position for the housing focused case management model. For rapid rehousing, we would be looking at per position a maximum of $60,000 a year annual salary, plus again the 20% MERCs, for a total of $72,000 per position. So in the application form, there will be a space where you can write that in. And like I said, you're welcome. Agencies are welcome to apply for more than one position and in more than one model. So just make sure that's indicated clearly. For project costs, especially where we're requiring that agencies be able to meet folks in the community, this is especially important here to ensure that we're compensating agencies fairly for mileage, car insurance, things like that. So that would be a maximum of $500 per month per position, so up to $6,000 a month annually per position. Direct client expenses are not applicable this year. We're just going to direct all of them through supported referrals, which is what we did in the last RFP as well. Administrative costs are eligible as long as they're not funded elsewhere. So for example, any proponents who are funded through the government of Newfoundland and Labrador multi-year agreements typically wouldn't be eligible for administrative costs, but otherwise we would approve up to a maximum of 10% of the total other approved funding. And then agencies are also encouraged to list in-kind costs here as well, which of course are any costs that are in addition to what we would be approving through our Reaching Home incremental funding. So these could be in-kind costs related to oversight or management or any other organizational supports. So what does all that total up to? Well, for each position under the housing focused case management model, it'd be a maximum of $92,400 per position. And under the rapid rehousing model would be a maximum of $85,800 per position. Okay, our evaluation criteria, I mean, there's 10 of them, so I'm not going to go into huge detail on all of them here, but there's a couple I did want to underscore that are of particular importance. Certainly, once again, that ability to meet participants in community is really critical to the success of this RFP. The model will also be really important. What we're looking to see is a suitable model for either housing focused case management, well, and or rapid rehousing. We would want to see that that model makes sense and also reflects the needs of folks on the by name list of people experiencing homelessness in our community. And of course, organizational capacity is also really important to this. And we want to underscore the fact that we do recognize there's a range of organizations out there that have been in operation. Some have been in operation for decades, some are only fairly recent. And we do want to underscore that certainly that can be bolstered by integrating with community partnerships and other, in a team approach across the community as well. So our timeline, I'm almost through this, and then we'll get into the question answers. So our timeline for this, we released the RFP on just Monday this week, February 21st. Today we're hosting the information session, February 24th. The deadline is on March 7th. The deadline is 11:59 p.m. So feel free right up till the end of that day. We are looking to have the successful proponents announced by Friday, March 18th. And we want to get this out as soon as possible because we recognize that it does have implications for keeping existing staff as well as recruiting new staff where necessary. So bear with us on that, but we are looking to get this done as soon as we possibly can. The project start date is officially Friday, April 1st, 2023. And then of course the project end date is March 31st, 2023, yes. All right, additional resources. We know we've got quite a hefty guide out there, about 20 pages. This is also includes, like I mentioned, Appendix A, which has a list of definitions. Appendix B has a summary of by name list data. The questions and answers that we're getting, whether they be through this webinar, whether they be through email, whether they be through the form on our RFP website, they will all be listed on that website. So any question that's asked to us, everyone will have the same information fairly and transparently. The link is there for the Reaching Home directives. That's some good supplementary information for folks. And of course, we always encourage folks to refer back to our St. John's Community Plan to End Homelessness 2019 to 2024. And there's also an annual update that we released last year as well. So last slide, I believe, is how to apply. There is just one application form. There's no separate budget form this year. It is in jot form. The signature is electronic, so no need to mess around with printing stuff out. It should be pretty simple for folks. When you press submit on that application, you will automatically receive a confirmation email, and it will have a copy of your application as well, so you can see actually what was sent. And then if you do have any questions, concerns, troubles, anything that comes up, feel free to either ask it today. Again, you can go back to the RFP website, or you can email any questions to Doug's email is listed there. So I think that is it. So now, yeah, I'll pass it back over to Simone, and yeah, we can address any questions that we get. And also, just want to say thanks to folks. I'm actually going to stop sharing now because it'll probably be easier for folks to be able to see us on the screen. So thank you very much, and I'll pass it back to Simone.
Thanks, Jennifer. So any questions that you might have, there's a Q&A feature at the bottom of your screen. I'll just give folks a few minutes to, it takes some time to actually think and articulate your question. So you can poke them in there, and then we can start answering them. And there's always a possibility, Jennifer and Doug gave you so much information today that you have 0 questions at all, which is also okay. The comment there in the chat that it was very detailed and lots of questions were answered. Absolutely. But we'll still give folks a few minutes.
Yeah, thank you, Leanne. Appreciate that feedback. We know that 20 pages is pretty hefty for an RFP guide. We certainly didn't want to overwhelm folks, but many of us have been on the flip side of having to apply for RFP, and it's always better to have that information to know what's being specifically looked for. So we really appreciate that feedback and hope that folks have all the information they need.
Everyone clear where to find things, how to apply, what's changed from the last RFP? I'll just ask a question while folks are thinking. Jennifer or Doug, one of you maybe perhaps just chat a little bit more on if you had to just describe the key differences between the last RFP and this one. Jennifer, perhaps?
I'll let Doug go first, and then I'll jump in.
Yeah, no, that's a good question. I mean, I think there's been key distinctions between all 3 of the RFPs that have gone to issue through the incremental funding and the COVID funding. I think, at a high level, the incremental funding allows our community to really focus its additional resources on some of the reaching home mandates around focusing on that, reducing chronic homelessness, reducing overall homelessness, versus, where we sort of slice and dice a lot of the funds to meet more of the emergency type needs, whether that was food security or isolation space for COVID related purposes. I think that's sort of at a high level. I think more importantly, we're as a community now, we have a quality by name list, and that's a really important milestone in our work to end homelessness and reduce chronic homelessness. So using that by name list, having that quality by name list, using that through the coordinated access to homes process allows us to really make efficient matches, make sure that we're getting real-time reporting, being able to report on that to the community, to all of our partners. That's a really key distinction, and I think it's a shift, no doubt. But if we look at what this RFP is designed to do, it's not designed to replace or duplicate what's already out there. It's actually really targeted for those who often don't get the services and supports they receive. And we have the mechanisms by which to make those referrals and track that progress towards that goal of ending chronic homelessness in our community. So a lot of hard work has gone into being able to, achieve a quality by name list, and how we go about using that through the coordinated access to homes process. Again, a lot of hard work has gone into that, with the End Homelessness team and with the community over the last 6-7 months and beyond. So I think, the foundation for what we were looking for in the past is now there, and we're able to target investments specifically for those individuals that reach that kind of reach the reaching home goals. So I think that sort of is at a high level, some of the main differences in sort of how we're using evidence and data to inform the decision, and how everybody in the community is contributing to that outcome. And so we're taking a big goal, or a big, sort of audacious goal around reducing and ending chronic homelessness in our community in about a year, and being able to now show exactly the way in which that can happen, using that data, using that evidence that informs the by name list, that informs the matching process through coordinated access to homes. So, that system that the feds want to see every community adopt, I think we're right there, and this RFP will significantly contribute to that goal.
Excellent. Anything to add to that, Jennifer?
I mean, Doug covered pretty much all of it, but yeah, just reflecting back on when we were planning for the 2021-22 RFP and looking at where we're at now, I mean, it's just head and shoulders above where we were this time last year. And that's, a testament to the hard work of the community and of this team in terms of, like Doug said, getting that quality by name list. And I know folks probably, you can certainly, the definition is in the Appendix A. But just so that folks know, one of the parameters of having a quality by name list is that we estimate that at least 90% of people in our community that are experiencing homelessness are included on that list. And what that means for us is that we're able to respond to the actual real-time needs of the community in a way we never have before. And we're able to work together more effectively. And I think, with that greater information on the needs of the folks that we're serving comes that accountability. Like, we have a responsibility now to the folks that are experiencing or at risk of homelessness in our community to serve them. And I just feel that we're in a much better way, a much better position to do this. And I think this RFP really addresses that.
Excellent. Thanks, Jennifer. And there's a comment there from Cindy that the RFP document was really well done, and it's helping to really focus the RFP responses. That's great feedback, Cindy. Thanks so much.
Thanks, Cindy. I did see Leanne raise the hand, but I'm not sure how you do that here.
We don't have a hand raised. I don't think we're able to unmute, but we can answer questions in the chat for sure.
Yeah, maybe while that question's being posed, I just throw it out there too that we're still looking at maintaining some level of an endemic response. Typically, we've had folks go up to the designated isolation site where required, and now that public health guidelines are shifting, especially for shelters and housing programs, we recognize that there's still a need for PPE. There's still a need to have additional staffing supports, and the harm reduction team is still on ongoing with Eastern Health. So aligning some of the shelter work team that was up at the designated site with that harm reduction team to support folks at the community level, whether it's through a setting up an isolation site to help cohort, offsetting some of the staff needs on that front. We're working with Eastern Health to still maintain some level of response on that, and as we identify what that is as a collective, we'll certainly be communicating that out through the regular channels, the Housing and Homelessness Working Group, Vulnerable Population Task Force, CAB, newsletters, and email to the community. So we'll communicate that out as we have it.
I'm not seeing other questions, but I will just ask another one of the two of you. In terms of the last RFP, there was a stream 1 and a stream 2, different projects in each, and this time there's no kind of reference to streams. So are folks applying in different streams, or are they able to apply in one application for different types of positions? Maybe you can speak a little bit more on that, just in case there needs to be clarifications. And then we also have a question from
Yep, for sure. So last time around, like I said, we didn't have as much information last year. When you don't know what you're looking for, you're what is it? What is that quote from The Wizard of Oz? No, it's from Alice in Wonderland. If you don't know where you're going, any path will get you there. Now we know where we want to go, and so we've very clearly defined that path. So I think in this RFP, it more closely resembles stream 2. And the reason for that is that we have a much better understanding of what homelessness looks like in our community as reflected through the by name list. And we really want to ensure that the positions that we're funding are integrated through coordinated access to homes and geared towards the real-time needs of people experiencing homelessness in our community. So
So there's a question there from Leanne. If you have one position under the case management model, I understand that the caseload is much lower due to more complexities. So I'm assuming it would be okay that you wouldn't see much new availability on the caseload. Is that correct?
That's absolutely correct. Yeah. And conversely, yeah, if you're under the rapid rehousing model, then you would be serving more people, but they would turn over more frequently. Absolutely. And the reason for that is that in our community, what we tend to see is there is a cohort of the population experiencing chronic homelessness, which, is outlined in the definition. I mean, that's 6 months out of the last 12 months or 18 months out of the last 3 years. Is this significant amount of time spent in homelessness, sorry. So what we're looking to ensure is that when we serve folks through a housing focused case management model, that we're not just only giving enough time on that caseload to be able to find housing and get housed. We're actually extending the time parameter that someone would be able to receive case management supports more into the future to enable more of that sustainability. And that's exactly what the Housing First model is all about, is ensuring that housing is found for an individual first and foremost. That's the first stop on the tour. And then working with the individual to identify, a participant focused plan moving forward and what are your goals into the future, and allowing that time after the person's been housed to work on those goals and to really set up what that looks like for an individual into the future. So that's why we say, a minimum length of stay would be 12 months. And, average length of stay, I mean, models do differ, but certainly, anything 12 to 18 months would certainly be reasonable. And just to put in a plug for Home Connect here, because Home Connect is our program that enables us to provide support for folks to access the private rental market. We do also require individuals to have a case manager for at least 12 months. So that dovetails really nicely with this housing focused case management program, which of course, I should have just let you say that, Simone. I don't know. I got carried away. See, I get so excited.
Great, thanks for that answer. And then there's also a question from Denise. Will there continue to be flexibility to support individuals who are incarcerated, who we know will experience homelessness when released, though they may not be defined as homeless when incarcerated, while incarcerated?
Yeah, I'll take a stab at that too. I mean, yeah, we've actually had a debate fairly recently in-house as to, because when someone's in a public system, in the healthcare system or in the correction system, their status does flip to what we call inactive, which means they're not currently actively looking for housing. So, we wouldn't be looking at finding them the same supports as we would for someone who's actively homeless. But Denise, this is a really great question, because there comes a point when we know someone's going to be released and that kind of kicks into gear anymore. They're no longer considered inactive because, they could be released any day now. So we don't have really specific parameters around this, because a lot of the time we don't have the ability to know. I mean, especially in corrections, we sometimes don't even know when a person could be released. It could be tomorrow, it could be a month from now. But certainly when we get an indication that an individual is eligible in the near future for release, then yes, they would, if they don't have a home to return to, and if they intend on returning to St. John's, then they would be considered homeless for the purposes of that. So yes, absolutely, we would be able to work with them in that context. Does anyone have anything to add to that? Because I know, it's a little bit murky, but this is it. I mean, this is what we talk about when we're talking about flexibility and being able to meet people where they're at, right?
Good. Abigail, anything to add on that one?
No, I think that's actually pretty comprehensive. I would fully agree that if someone's going to be released, we know that someone's going to be released into homelessness, and we like being able to pick that up as quickly as possible is very important and definitely counts.
Okay, excellent. Any other questions, folks, in the chat? Doing pretty good for time. We got another 10 minutes if we need it.
And I did notice there is a button that we can allow people to talk to. So if anyone wants to be brave and ask a question, I think we can probably try that out.
Okay. We'll just give it another couple of minutes. I'm just looking to the other panelists that are here. Abigail, Pam, anything you want to add to this conversation just while we're waiting for final questions? Nope. No clarifications you want to make? Excellent.
Yeah, I mean, maybe
we had to bring in Pam and Abigail for the questions related to data and how CAH functions, and so we don't want to lose their expertise in that area.
Yeah, I don't want to rush us here. So perhaps as we are kind of nearing the end and the questions don't seem to be flowing in anymore, it seems like it's been quite a comprehensive presentation. Perhaps I can turn it to yourself, Jennifer, and Doug for any final thoughts. First you, Jennifer, then you, Doug, and folks on the line, that will be your final chance here. Ample warning, we'll be signing off. So if any other questions, you can do it at that time. So Jennifer, to you, and then to you, Doug.
Yeah, I mean, I appreciate that and appreciate the folks joining the call today, and it will be recorded, of course. So folks, do you have any questions that come up, just pop them in on the website, or you can email Doug. But yeah, I was thinking, you know, just as, yeah, what would the final thoughts be? And I just want to mention, you know, how important it is for End Homelessness St. John's to be able to work with the community of practice at the national level. This work is, I mean, it's so hard, like in the sense that there's no guidebook to follow for how to end homelessness. I mean, it is such kind of an intimidating problem with so many different elements to it. But we're lucky in the sense that, of course, we have the guidance provided through Reaching Home and also through Built for Zero Canada. It's so very rare that whenever we do anything, you know, we put a question out to, you know, the national level, and it's just like, did anyone do this? And it's like, yes, we did. Here's what we found out, or here's how we did that, or here's our model. Like, everyone is just so willing to share. So I just really wanted to, you know, just to put a bit of context around this RFP that, yeah, I mean, while some of this stuff is new to End Homelessness St. John's, it's not new nationally, and we're able to subscribe to best practices that have been implemented across the country. And it just gives us a lot more peace of mind, you know, that, okay, this has worked elsewhere, so we can make it work here. And it's just been really great to work with our national colleagues as well. I think that's that's really where my final thoughts are. Yeah, Doug?
Yeah, great. Yeah, and I think that's a really important context as well. It's really great to have that national network of peers, you know, whether it's at the community entity level or the frontline level. So, you know, whether you realize it or not, we're all connected to that space, and happy to support the community's, you know, engagement in that as well over time. So, I guess in terms of some final thoughts, you know, we're trying to be as proactive as we can. We don't have confirmation yet from Reaching Home that we're even going to get additional funding. We do have reason to believe so, because they've continued to maintain that this current government wants to sustain those levels of investments through Reaching Home through at least the next 2 years. So, you know, while we don't have confirmation yet, we really want to be proactive with the community to make sure that we can maintain as much continuity as possible. But also, you know, again, thinking about the work over the last, you know, 2 years with ourselves, with the community, and with our partners at the provincial level, we have so much more information and data today to support the work that we're doing at a community level, at a systems level. And so to get to this point is really a critical milestone in our work to end homelessness in St. John's, which is something that no organization can do alone and no one pot of funding can do alone. So being able to use this round of funding to support that work, to augment the existing work of the community is so critical. And it's just another opportunity for us to really collaborate and coordinate our efforts in that much more meaningful way. So I really appreciate everybody's time to join and the thoughtful questions that have come out. And thanks for all of your time today, and happy to answer questions, like Simone said, along the way leading up to the closing date on March 7th. If anybody has questions, feel free to reach out, and we're happy to support.
Wonderful. Thanks so much for those final thoughts. A huge thanks to all of you for joining us today and kind of making time in your day to get a more in-depth dive into the RFP guide. Any follow-up questions, just email Doug and the other methods that were outlined for you, and all of the questions will be posted on the website. So huge thanks, everyone, and we'll leave it there. Thank you very much. Take care.